Welcome to MLT 101, Human Anatomy. My name is HM1 Barnes, and our lesson topic is the heart. The heart is a four-chambered, hollow, muscular organ and is slightly larger than a closed fist. It is surrounded by a thin, fluid-filled sac called the pericardium, and the walls of the heart are made of three distinct layers. The outer layer of the heart is called the epicardium. It's a thin, watery membrane and is continuous with the lining of the pericardium. It covers the heart and attaches the heart to the pericardium. The big major layer, the middle layer of your heart, is a thick layer of cardiac muscle called the myocardium. If you look at that word, you can tell what that word means just by the structure of the word. You have myo, which refers to muscle, and cardi, which refers to the heart, and then pertaining to. The word literally means heart muscle. Your myocardium is the part of the heart that actually contracts to pump blood into the arteries. Then you have the inner layer of the heart, called the endocardium. It's a thin layer of epithelial cells and is continuous with the lining of the blood vessels. It lines the inner chambers and valves of the heart. Your heart has two sides, a right and a left. They're separated from each other by partitions that are referred to as septa, plural, or septum, singular. Each side, the left and right side, each side has two chambers, an upper chamber and a lower chamber. The upper chambers of the heart are called atria, or in atrium. The lower chambers of the heart are called ventricles, or a ventricle. There are one-way valves between the chambers of the heart that help prevent the backflow of blood, to keep blood moving through the heart in the right direction. A one-way valve is a structure that is shaped so that fluid or air can flow through it in one direction, but it'll close itself up if that liquid or air tries to flow back the other way. It prevents backflow. When these malfunction in different types of valve failure of heart disease, it can actually be heard with a stethoscope. If you put the stethoscope up on top of the valve that is having a backflow problem, it sounds almost like the swoosh, swoosh of a washing machine. The heart can sound like thump, thump, swoosh instead of thump, 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 thump. It's like thump, thump, swoosh. The atria are receiving chambers. They receive blood from outside the heart. They push that blood into the ventricles, which are the large, strong portions of the heart. The ventricles contract, and when they do so, they pump blood out of the heart, so we refer to them as delivering chambers. The valves at the entrance to the ventricles are called atrioventricular valves, or AV valves for short. The valves that exit the ventricles are called semilunar valves, because they are crescent and shaped like a half moon. The easy way to remember the name of atrioventricular valves is they're the valve that's in between the atrium and the ventricle. Hence the word atrioventricular. It sounds like a combination of atrium and ventricle. There are two partitions that separate the right and left sides of the heart. They're referred to as septa. The partition that separates the right and left atria is called the interatrial septum because it's in between the atria. The partition that separates the right and left ventricles is called the interventricular septum because it separates the ventricles. Each septum consists primarily of myocardium, of heart muscle. The heart muscle is a little bit counterintuitive because you would think it's pumping all this blood. It's got the world's best supply of oxygen and nutrients that could ever be found in the body. Well, that's not exactly correct because the heart muscle does not receive oxygen or nutrients from the blood that is currently flowing through it. It has its own separate blood supply. It receives blood from the right and left coronary arteries. These are also called the cardiac arteries. They branch off of the aorta, which is the main artery directly coming out of the heart. Think of these two arteries, the left and right coronary arteries, like the first stop off the highway as you're coming out of town. You take the first turn. They're just past the aortic semilunar valve. Any impairment of the coronary circulation is an incredibly dangerous situation. Partial obstruction of a coronary artery or one of its branches can reduce the blood flow in that artery to the point where it's not adequate to meet the needs of the heart. This is a condition called myocardial ischemia and can be painful. This is one of the reasons that it's always recommended to go see your physician if you're having chest pain. Complete obstruction or prolonged ischemia leads to what is called a myocardial infarction. In the hospital, we call it an MI. Out on the street or on TV, people call it a heart attack. This happens because of necrosis or the death of the tissue surrounding that blocked off area. If the blood flow gets completely blocked and the heart muscle stops receiving oxygen, the heart muscle that is downstream of that block will die. There will then be a dead spot on the heart. There is no way to bring that back. It is a permanent reduction in the usefulness and the functionality of the heart, and can be up to the point, depending on the severity of the myocardial infarction, a singular fatal event. It may take more than one to kill someone, but often a single myocardial infarction can be enough to kill a person. Coronary veins return oxygen-poor blood from the heart muscle back to the heart. Most coronary veins merge into a structure called the coronary sinus, which delivers the blood to the right atrium. Some coronary veins will empty directly into one of the chambers of the heart. The cardiac cycle, which is a complete contraction and relaxation of the heart, takes about 0.8 seconds. The contracting phase of this cardiac cycle is called systole. The relaxing phase is called diastole. This is why when you get your blood pressure taken, you get two numbers. The big number on top, your systolic blood pressure, is the pressure of your blood when it is in systole. When your heart is actively contracting, actively pumping and pushing blood through your body, that high pressure is your systolic blood pressure. When your heart is relaxing, that lower number is your diastolic blood pressure.